Hello, my name is Gina Jimenez, and my informative speech is going to be over NICU nursing. Did you know that 4.8 million children died before their 5th birthday in 2023? When a baby gets sick, do you ever wonder who takes care of them and how you can take care of those sick babies? Well, NICU nurses are the ones who take care of those babies, and I'm going to tell you how they take care of those babies and the requirements they need. NICU nurses are specialized registered nurses who provide acute and critical care to premature and ill newborns in a hospital setting. In this PowerPoint, I'm going to go over what a NICU nurse does in a hospital setting, the skills required to care for these children, and the emotional and physical challenges, rewards of this healthcare profession for the nurses and families. This is what NICU nursing is. And for the skills required, or what the NICU nurses do in the hospital settings, is they have daily duties combined with highly technical medical responsibilities with providing direct infant care and emotional support to families. NICU nurses have to constantly monitor a baby's vitals signs, give life support, give medications and nutrition advice, giving medical procedures, and responding to emergencies. NICU nurses have a big part in the hospital, but how do they get there? In the next point, we are going to talk about how to become a NICU nurse and the skills you need. For education, NICU nurses have to have a nursing degree in either their ADN or a BSN, and they have to do clinical rotations to prepare for entry-level nursing. In this picture over here, you could see all the nursing students with the doctor doing their clinical rotations. For the skills that they need to have critical central line management, ventilator management, extreme precise medication calculation and admission, and assisting with advanced procedures. And you see them doing that here with the NICU, with the baby in the NICU acute that they have to provide for them. The emotional and physical challenge they have to do. For emotional, for the nurses, that they have burnout and compassion fragile. And then for the emotional, for parents, is trauma and anxiety. And for physical, nurses have long and demanding shifts. And for the parents, they have exhaustion. And the rewards in the nursing is making a difference. And the rewards for the parents are celebrating milestones for their kids when they're just dealing with all this. In this picture, you could see the nurse and the family with the baby celebrating about how just the milestones they're doing. Some fun facts about NICU nurses are NICU nurses are often called baby whisperers because they have the ability to smooth and care for these babies. Some NICU nurses were once NICU babies themselves. As you see in this picture, this is a parent helping with their child in the NICU. And over here, we have the nurses providing for the NICU kid. For my conclusion, NICU nurses have an important role in hospitals for premature and ill newborn babies. What they have to do in the hospital, the challenge they face, whether it's physical or emotional, and how skilled they have to be to become a NICU nurse. NICU nurse help with newborns when they're ill and when their job is important because they blend skill and compassion to protect life's most fragile beginning. And then here are my resources and the information I got. And just to go over the photos, these are what NICU nurses normally do for babies. They have to hold them and take care of them. And that's why their job is really important, because they have to care for these children really importantly because they're in the beginning of their lives and they're not doing good. So NICU nurses have a really important role in the hospital, and that's why their job is important. And this is what this PowerPoint went over to explain the importance of the jobs the nurses have to do for these newborns and these infants. So that's the end of the video. Thank you for watching.